In our private Medicare Q&A with Boomer Benefits Facebook group, we occasionally see working seniors ask how to disenroll from Medicare. Because we live in a digital world, it's easier than ever for people to work past age 65 or to retire from their career, but take a new job in a different field for a few years. They may want to disenroll from original Medicare when they have a new opportunity to be covered by creditable employer group health insurance. There are only a few circumstances where you can do this, and in this video, I'll go over them and explain how you can take action on them. Hi there, I'm Danielle Roberts, co-founder at Boomer Benefits and best-selling author of 10 Costly Medicare Mistakes You Can't Afford to Make. Before we get started, be sure to hit the subscribe button below to keep up with any important Medicare updates that we release here on our YouTube channel. At age 65, Social Security will automatically enroll certain people in Medicare Part A and B. If you begin receiving Social Security benefits at least 4 months before your 65th birthday month, the Social Security Administration will assume you are no longer working and enroll you in Medicare Part A and B. Your Medicare will begin the first of your 65th birthday month. But if you are still working or your spouse is working and you're covered by an employer insurance plan, you may not want to pay for Medicare as secondary insurance. You can disenroll from Part B if you or your spouse actively work past age 65 and your employer has 20 or more employees and you're covered by their group health plan. Later, when you leave that employment, you'll be able to re-enroll in Medicare without any penalty. There's no need to cancel Part A unless you plan to contribute to a health savings account. Part A will coordinate with your employer coverage, and most people pay $0 for Part A, so you can leave that in place. If you do decide to disenroll from Medicare, you will contact Social Security and let them know that you're covered by a large employer health plan and want to cancel. You'll fill out a request for termination. This is CMS Form 1763. Social Security will likely want to schedule an interview with you to discuss the consequences of dropping Part B. Now, if you are planning to contribute to a health savings account through your employer, you will also need to disenroll from Part A. However, if you are auto-enrolled in Medicare due to signing up for Social Security benefits, that's because Medicare Part A and Social Security are irrevocably linked. You cannot cancel Part A and continue to receive Social Security benefits. If you do cancel Part A after 65, you will also have to pay back any money you receive from Social Security while you were enrolled in Medicare. So just be aware of these consequences of disenrolling from Medicare Part A. We also sometimes meet beneficiaries who are not taking Social Security benefits yet, but they retire from their employer coverage and they sign up for Medicare Part A and B and either a Medigap or Medicare Advantage plan. Then they find themselves bored in retirement, or a new and interesting employment opportunity comes along and they decide to go back to work. If you go back to work for an employer with 20 plus employees and enroll in their health insurance plan, you can disenroll from Medicare and your Medigap, Advantage, or Part D drug plan. You will need to contact your Medigap and Part D or Advantage plan carrier to ensure that they cancel your policy. You will not receive a Part B late enrollment penalty if you delay Part B due to creditable coverage from your employer or a spouse's large employer. Later, you can use a special enrollment period to re-enroll in Medicare once you re-retire or lose your active employer coverage. When you later re-retire, your re-enrollment in Part B will trigger a new Medigap open enrollment period to apply for that Medigap plan without underwriting. This is one of the very few scenarios where a person gets a second Medigap open enrollment opportunity in their lifetime. Now, let's talk about disenrolling from Medicare plans when your reason is not related to employer coverage. When you enroll in a Medicare Advantage plan, you will receive your Medicare Parts A and B benefits through your private insurance company. Many Advantage plans also include a Part D drug plan built in. Medicare Advantage plans have lock-in periods, and you can only switch to another Medicare Advantage plan or return to original Medicare during certain times of the year. For example, the Medicare Advantage open enrollment period occurs annually from January 1st to March 31st. During this time, you can disenroll from your Medicare Advantage plan and return to original Medicare, or you could switch to a different Advantage plan. Your Medicare Advantage plan switch or disenrollment will become effective on the first of the next month. You can also use the annual election period from October 15th to December 7th to return to original Medicare or switch to a different Medicare Advantage plan. The annual election period is also the time when you can drop or enroll in a standalone Part D drug plan. If you're dropping a Medicare Advantage plan to return to original Medicare, you probably want to enroll in a standalone Part D drug plan for drug coverage, and you can do this during the annual election period. When you use the annual election period to disenroll from an Advantage plan and return to original Medicare, your last day of coverage with your Advantage and Part D plan will be December 31st. Your new coverage will begin on January 1st. The annual election period is the only time when you can change your Part D drug plan unless you qualify for a special election period. A special election period will apply only in certain scenarios, such as you move out of the plan's service area, you lose other creditable coverage such as Medicaid or COBRA, you have the opportunity to enroll in creditable coverage for Part D, such as large employer insurance, which we covered earlier in this video, or your Part D plan changes its contract with Medicare. If any of these scenarios apply to you, you can disenroll from your Part D plan by calling Medicare directly or contacting your Part D plan provider. The provider will usually require that you submit a disenrollment request from the provider or mail in a signed letter to your provider. If you are a Boomer Benefits client and you need to disenroll from Part D, you can also just call us and we'll walk you through every step. So these are the different ways to disenroll from Medicare, Medicare Advantage, and a Part D drug plan. But when you work with our team here at Boomer Benefits, you will never have to go at it alone. If you plan on disenrolling from Medicare due to creditable employer group health coverage, check out this important video on how to reapply for Medicare after working past age 65.